We know COVID-19 can attack the heart, damaging your heart muscle and causing blood clots. Don't ignore your symptoms. We are here to answer your questions and help protect your heart. When my patients ask me about COVID, they're concerned not just about the acute process, but what could be the long-term consequences and things that still have not come out to be clearly defined yet. I have seen patients in the hospital and also patients in the office. I have even family members that have been affected, so I've been involved very closely with their care. The issue about the parts that we don't know, especially when it comes to the heart, there is new data emerging that there can be some long-term consequences with how the heart works. So heart failure, among other things, and arrhythmias are two of the bigger concerns. Unfortunately, this is still too early to really define that. So for patients, especially those with prior cardiac history, it is important to communicate and to be checked. For patients who were healthier prior to that, the concern is still going to be less, but we can't tell for sure if there will be long-term consequences. So for new symptoms, patients should be checked to be on the safe side. Sure, people should follow the guidelines, should follow the recommendations. The truth is that many patients, and probably the huge majority, are asymptomatic. So an asymptomatic carrier can be passing on disease without knowing, and people can be getting sick without knowing, and this is how this potentially exposes further people. The ones that have some heart conditions, the elderly and so forth, are going to be at a much more risk and a disadvantage if this were to happen. So we got to take care of ourselves, and we got to take care of the rest of the people as well.